Hey there, I'm Dr. Powell. This video is a 7-month follow-up of a guy who had his first hair transplant. The purpose of this video is to show you how natural hair transplants can look if you choose the right clinic. Let's take a look at some photos. This first set of photos are taken on the day of surgery of this guy. Let's call this guy on the left here Johnny before, and this one here on the right Johnny after. So some of you might be saying, what is going on with this guy's scalp over here? Well, these are all normal changes after having had a hair transplant. All this redness, this shininess, and the swelling, that will all disappear after a couple of days. And if you form any scabs, those will fall off if you follow the proper washing techniques that we teach you. So after several days after the surgery, this should look like normal scalp with a short buzz cut. So let's get back to, and the reason why I showed you this photo is to illustrate how we helped him carry out his short-term hair restoration goals. So let's jump back over here to Johnny before. Now, if you saw this guy at a gathering, at a party, you can obviously see that he is balding and losing his hair. You see he's got significant loss in the frontal third here. He's got some thinning here in the mid-scalp. And it's no surprise to anybody that this guy has classic signs of male pattern baldness, which typically likes to start in the corners, pushing backwards, creating these alleyways, and then kind of jumps into the middle, thinning out this area in the central portion. And then the hairline kind of continues its march backwards. So here Johnny's starting to form this mohawk type of formation. This is known as an M-shaped hairline. So what we did for him is we recreated his hairline. We put it at a natural height that would age well with him over the years. We filled in these balding areas, and then we reinforced this thinning area here. So here post hair transplant, immediately post-operatively, you see we did the frontal hairline with the dense packing. We used only grafts that had one hair follicle per graft to create this natural, gentle transition from the hairline to the hair behind it. Immediately behind the hairline, we continued with the dense packing, but in this area we used follicles that had 2 or more hairs per graft to increase the density in this frontal band. You might notice that the central area here is not as dense as it is in the frontal band. And the reason being is the blood supply in this area is not as good. And if you try and pack too many hairs or grafts into the area, you could risk complications such as poor growth. So this next set of photos are Johnny before, the day of the surgery, and this is 7 months later, Johnny after. And you could see what a dramatic change it makes between the two pictures. They're day and night. The Johnny before, he's got a very indistinct, irregular, and moth-eaten hairline, giving him an unattractive appearance to his upper face. Compared to Johnny after his hair transplant, he's got a very well-defined hairline, and he looks like he's got a decent amount of hair. And I just want to point out, look how natural it looks, even just 7 months after his transplant, where it just started to grow. Remember here he had this bald spot, which is completely gone here. Look what a dramatic change it makes to his profile, bringing back that hairline and closing off that corner. Looking at these two photos, the one on the right, Johnny before, day of surgery, and 7 months later, Johnny after. And again, what a dramatic difference between these two photos. So here, Johnny before, on the day of surgery, we drew on the hairline at an appropriate height that would age well with him and look natural. And just wanted to point out this bald spot here. We obliterated that. It's completely gone 7 months later. These are all transplants. And again, look how natural it looks. It doesn't look like somebody who had any work done. It just looks like a guy who has a decent amount of hair and maybe starting to thin. I know what you might be thinking, that the density is not that great considering he's had a hair transplant. But what you have to keep in mind is that this is only 7 months after his hair transplant procedure, meaning only 60 to 70% of the hairs have actually woken up at this point and popped through the scalp and started growing. And these hairs that have popped through the scalp and started growing are still immature. And over the next several months, as they continue to grow and mature, their shafts will thicken in diameter, adding to the final result of increased thickness and density. Also, over the next couple of months, the remaining 30 to 40% of the hairs that are still sleeping in the resting phase will begin to wake up and pop through the scalp, further adding to the thickness and density of the final result. So this density here eventually in another 12 months after the procedure to a year and a half after the procedure should be very close, if not matching, the density that you're seeing in the central portion here. Comparing these photos of Johnny befores and the Johnny afters, who would you rather look like? If you look like Johnny before and rather look like Johnny after, hair transplant surgery is the only solution to give you permanent, natural looking results if you choose the right clinic. Well, I hope you found this video helpful. Please stay tuned for more videos in the future.